general characteristics of a few ear conditions in a way that's simple to understand. These conditions can range from mild to severe, so let's go step by step. First up, keratosis obturans. This condition is caused by abnormal epithelial migration in the ear canal. It typically presents with severe ear pain or otalgia and can cause conductive hearing loss. It's often seen in younger individuals and may sometimes be bilateral. On examination, we might find a keratin plug, thickened eardrum, a widened ear canal, and skin inflammation with granulations. Treatment usually involves removing the keratin plug and addressing the granulations. Occasionally, a biopsy is done to rule out other causes. Next, we have auditory canal cholesteatoma. This occurs due to abnormal bone, leading to epithelial migration into the bone. Patients usually complain of mild pain, a blocked sensation, or itchiness. It's more common in older individuals and is typically unilateral. The pathology often shows keratin deposits in a random pattern and localized erosion of the ear canal, with bone sequestration. Treatment involves surgical removal of the cholesteatoma and grafting, often with cartilage and fascia. Moving on to benign necrotizing otitis externa, which is caused by avascular bone leading to inflammation of the overlying skin. Patients may have chronic painless otorrhea, which partially responds to treatment. The exposed bone in the ear canal is usually 3 to 10 millimeters in diameter and accompanied by dehiscent skin. Pathologically, there's chronic inflammation, but no evidence of keratin or cholesteatoma. Bacteriology often shows commensals. Treatment starts conservatively, but may require surgical removal of the sequestrum if needed. Lastly, let's talk about malignant necrotizing otitis externa. This is a more severe condition, often seen in immunocompromised individuals, such as those with diabetes or renal failure. It presents with severe, penetrating pain, cranial nerve palsy, and raised inflammatory markers. Pseudomonas aeruginosa is the common culprit in this condition. Treatment focuses on addressing the underlying immunosuppression, high-dose antibiotics, and sometimes surgical debridement. Long-term antibiotics may also be required in many cases. It's crucial to differentiate between these conditions accurately, as some, like malignant necrotizing otitis externa, can mimic neoplasms. A thorough examination, proper imaging, and laboratory tests are key in guiding treatment.